Now, over 250 Gauteng Junior Doctors are still waiting to be placed at hospitals for their community service. These doctors have completed their 2-year internship as part of the Health Department's Community Service Training Program and should begin their community service in July. Now, completing community service is essential for them to receive their full medical degree. The junior doctors always seem to find themselves in limbo, though. What could the problem really be? For more now, I'm joined by the chairperson of Employed Doctors Advocacy Forum, Dr. Akhtar Hussain, who joins us virtually from Durban. Dr. Hussain, thank you so much for your time. There are many things you could set your clock by in South Africa, and one of them is the season for junior doctors to be placed in their community service positions. We have this conversation year in, year out, and every year there seems to be a problem with the lack of communication and the lack of organization to get these very important persons to keep our healthcare system's wheels turning, placed in the positions in places where they need it most. What is the problem and why can we not get it right?
Thank you very much for having me, ENCA, and your listener. You are 100% correct that this problem is consistently happening year after year. We from South African Medical Association continuously engaging National Department of Health. The junior doctor, especially internship for 2 years and community service for 1 year, which is the Section 61 of the Health Professional Act, 56 of 1974 mandatory. It must be provided by the Department of Health and National Government for the training in medicine. Without that, they cannot practice independently medicine in South Africa. So what's happening? Every year, supposed to do the placement October, September, October, the placement must be done for the January placement. Then the second placement is for mid-year cycle, which start from 1st of July, and they're supposed to do the placement by April and May. And the challenge is either the ICSP, the Intern Community Service Placement Program, either they have a challenge of a shortage of staff or the digital system or computer not working. Now the issue of electricity is not there, so they cannot place in time. And on the top, the provinces had a budget cut, so they don't announce their the post of intern and com service, how many vacant posts, how many they can absorb in each province, and their huge delay by the provinces and national department mismatch. So we as a SAMA have been advising them that the interns budget and community service budget must be separated. And we got the information. Treasury always say there no moratorium for doctor's appointment, but that is not ending there. If one doctor resign or anyone retire from the public sector, that post disappear. They don't advertise those posts. And at the moment, doctors are overworking, and critical level of staffing numbers are not there. And at the moment, also, they haven't announced that they are going to absorb those who completed post-community service, because they are the one biggest number are without job at the moment in public sector. So the issue is compounding every year. And this July placement, actually, they are saying 90% placement has been done. And all the South African citizens who qualified from South African Medical School, the placement has been given, the email and letter have been issued, and there are some challenge that the emails are bouncing back. That's why many of the doctors haven't received their placement. This is the pure challenge, because if you don't announce in time where they're going to get the accommodation, how they're going to move their family, and whether they can start in time, That is the biggest problem.
Why does it need to happen so last minute? Why are we waiting for the applications or that process to close the 28th of May and then expecting them to be in a position in a month and a half's time from that? Is there a way that this could be done at least 6 months in advance in terms of planning, A? And B, what happens to doctors that are not placed? How problematic would it be for their eventual real qualification, would it be for them not to be eventually placed for their community service?
Community service and internship is a mandatory. Government have to place them. There are no way any interns who qualified from our medical school and they have to give them a training that is 2 years. So it's a totally responsibility is our Department of Health, National Department of Health, to make sure they go and do their training under supervision. And why they are not managing, because they don't have proper strategic planning and they haven't planned for the budget properly. That's why they always delay. They're looking for funded posts. And this needs to be done beginning of the year for whole year program. So whether you placing 1st July or 1st October, it must not affect internship or community service training. Before they used to have a 4 intake, 1st January, 1st April, 1st July, 1st October. They cut down now only 2 intake. And those who qualified in between, they're sitting at home. And that is not acceptable.
So what happens next? For those 200, as much as more than 90% have been placed, we're talking about the lives and the families of over 200 junior doctors who are still in limbo. Are you confident that they will be placed by the beginning of July?
Oh, yes. As we had a discussion with the Department of Health authorities, they have said that there were 260 interns and community service supposed to be placed. Out of that, they have already placed almost 90%. And the rest of them, they are working on it. And if anyone haven't got the placement, I think South African Medical Association, we need to take this up, and strongly we need to fight their cases. And no one must sit at home and start 1st July.
Okay, well, we'll keep eyes and ears peeled for any information on those placements. That's Chairperson of Employed Doctors Advocacy Forum, Dr. Akhtar Hussain.